Hey everyone, and welcome back to the channel. Today we're diving into a topic that causes a lot of confusion and anxiety for men: PSA levels. Specifically, we'll answer a very common question. How long can your PSA stay elevated after normal activities like ejaculation, cycling, or even a doctor's exam? Understanding this timeline is crucial because it can help you avoid unnecessary stress and ensure you get the most accurate test results. Let's break it down with a simple timeline and talk about what to do next. First, let's quickly recap what PSA is. PSA stands for prostate-specific antigen. It's a protein produced by the prostate gland, and a small amount of it naturally leaks into the bloodstream. A PSA test measures this level. An elevated PSA can sometimes be a sign of prostate cancer. Batand. This is a huge bataise, much more often caused by other non-cancerous things. This is where today's topic comes in. Several common activities can temporarily spike your PSA levels, leading to a false positive result that can cause a lot of worry. Let's start with one of the most frequent questions: ejaculation. Ejaculation involves strong contractions of the prostate gland to expel semen. This mechanical stimulation can squeeze more PSA into your bloodstream than usual, causing a temporary increase in your levels. So, how long does this effect last? The general medical advice is to abstain from ejaculation for at least 48 hours before your PSA test. This 2-day window is usually enough for the levels to return to their baseline. Some doctors might even suggest 72 hours just to be extra cautious. Think of it like letting the dust settle after shaking up a snow globe. You need to give your body time to restabilize. Rushing to get a test done the day after sexual activity is one of the most common reasons for a falsely elevated reading. Next up, let's talk about cycling. This is a big one for all the avid cyclists out there. When you ride a bike, especially with a traditional narrow saddle, you're putting direct sustained pressure on your perineum, the area where your prostate is located. This pressure and the vibration from riding can irritate the prostate, causing it to release more PSA. It's a form of physical stimulation, just like a massage. So, what's the timeline here? The recommendations for cycling are very similar to ejaculation. You should avoid any strenuous or long-distance cycling for at least 48 to 72 hours before your PSA test. This gives any inflammation or irritation time to subside and your PSA levels to normalize. If you're a daily bike commuter, you might want to switch to another form of transport for a couple of days leading up to your blood draw. It's a small change that can make a big difference in the accuracy of your results. Now, let's move on to a medical procedure: the digital rectal exam, or DRE. During a DRE, doctor inserts a gloved, lubricated finger into the rectum to physically feel the prostate for any abnormalities, like lumps or hard spots. This direct manipulation of the prostate gland is well known to cause a significant temporary spike in PSA levels. It's basically a direct massage of the gland. Because of this, the standard practice is to always draw blood for the PSA test before performing a DRE. If your doctor does the DRE first and then sends you for a blood test right after, your PSA is almost guaranteed to be elevated. If a DRE is done first for some reason, how long should you wait? The effect can be more pronounced than with ejaculation or cycling. Most experts suggest waiting at least 1 week, and some even recommend waiting up to 2 weeks before having your PSA level checked to ensure the reading is back to your true baseline. So let's put this all together into a simple timeline. For ejaculation, wait at least 48 hours. For cycling, wait at least 48 hours. For a DRE, wait at least 1 week. But what about other things? Other factors can also affect your PSA. For example, a urinary tract infection or prostatitis, which is inflammation of the prostate, can cause PSA levels to skyrocket. And they can stay high for weeks or even months until the underlying infection or inflammation is fully treated. In these cases, your doctor will typically prescribe antibiotics or other treatments and then retest your PSA several weeks later. Even a recent urinary catheterization can elevate PSA, so it's important to wait a few weeks after that as well. So, what should you do with this information? The key is communication and preparation. Before your scheduled PSA test, Make a conscious effort to follow these guidelines. Let's create a simple pre-test checklist. First, for at least 2 to 3 days before your test, avoid all sexual activity that leads to ejaculation. Second, for at least 2 to 3 days before your test, avoid riding a bicycle or engaging in any activity that puts a lot of pressure on your perineal area, like riding a motorcycle or a horse. Third, always ensure your doctor draws the blood for the PSA test before performing a DRE. If you happen to forget and do one of these things, don't panic. Be honest with your doctor. Tell them, hey, I rode my bike for an hour yesterday, or I had a DRE last week. This context is incredibly valuable. Your doctor won't be annoyed. They'll be glad you told them. They can then make an informed decision, which usually means rescheduling the test for a later date to get an accurate reading. What happens if you follow all these rules and your PSA still comes back elevated? First, again, don't panic. A single elevated PSA test is not a diagnosis. It's simply a signal that further investigation is needed. Your doctor will likely take a watch-and-wait approach. They'll probably ask you to come back in 4 to 6 weeks to repeat the test. This helps to see if the elevation was just a temporary blip or if it has a persistent trend. They'll also consider your age, your family history, the size of your prostate, and how quickly your PSA is rising over time. This is called PSA velocity. If the levels remain high or continue to rise, your doctor might recommend further tests. These could include a free PSA test, which helps distinguish between cancerous and non-cancerous conditions, or imaging like an MRI of the prostate. Ultimately, a biopsy might be suggested to get a definitive answer. Remember, the PSA test is a screening tool, not a perfect diagnostic tool. Its main purpose is to help catch potential problems early. By understanding the factors that can influence it and preparing properly for your test, you empower yourself and your doctor to make the best decisions for your health. Being proactive about abstaining from these activities is a simple step that can save you from a lot of unnecessary anxiety, additional testing, and worry. It puts you in control of your health journey. And if you're ever feeling overwhelmed or anxious about your test results or your health, please talk to someone. Speak with your doctor, a trusted friend, or a mental health professional. Getting support is a sign of strength. So, to recap the simple timeline, avoid ejaculation and cycling for at least 48 hours before your PSA test. And make sure your blood is drawn before any digital rectal exam. If a DRE is done first, wait at least a week before the blood test. It's that simple. Following these steps will give you the best chance at an accurate baseline PSA reading. I hope this breakdown was helpful and cleared up some confusion. Managing your prostate health is a marathon, not a sprint, and knowledge is your most powerful tool. If you found this video valuable, please give it a thumbs up and consider subscribing for more straightforward health information. Drop any questions you have in the comments below, and we'll do our best to answer them. Thanks for watching, take care of yourselves, and we'll see you in the next video.
Thanks for watching. Stay informed, stay calm, subscribe for calm, evidence-based health here on Nourish Today.